Hey everyone, Kate here again, ready to help you figure out what exactly is making all that ruckus in the PICU. The ICU is a noisy place, due in large part to the monitors we use to keep our patients safe. In this video, we'll talk specifically about the non-invasive monitors that we use on the patients in our unit. A lot of these devices will be familiar from your time on the floor, but we'll still spend a few minutes talking about them, as the way that they're used in the ICU may be a little different than what you've seen in other settings. These are the 4 types of non-invasive monitors we'll cover in this video. Let's get started. First up is telemetry, which, as you know, gives information about the patient's heart rate and rhythm obtained from patches on the chest. The normal heart rate, of course, varies depending on the patient's age, but we pretty much always want our patients to be in sinus rhythm. Unlike on the floor, all of our patients are on continuous telemetry throughout their stay. The heart rhythm shows up in green at the top of the bedside monitor, with the corresponding rate immediately to the right. Depending on how the monitor is set up, there may be a graph showing trends over time between the tracing and the rate. When looking at your patient's telemetry, note the heart rate trends and any rhythm issues they may have had. Also be aware of loss of variability or shifts in the heart rate away from the patient's baseline. If you suspect a rhythm issue, talk to your fellow about getting a full EKG, which provides much more information than the bedside monitor. Next up, pulse ox. In most situations, the target oxygen saturations are greater than 90%. Like on the floor, we measure oxygen saturation via both the little stickers on infants and smaller patients and with the clip-style finger sensor in older kids. The pulse oximetry tracing shows up on the bedside monitor just below the heart rate. An accurate measurement depends on adequate perfusion. If the numbers are lower than you would expect, be sure to check the pleth or waveform. If the patient is moving around a lot or the perfusion is poor, like on the left portion of this image, this will be reflected in the waveform and will likely result in an artificially low measurement. The pulse ox also detects heart rate, as shown here. If you have a concern about the heart rate reading from your telemetry, this can be a quick way to double check, as these numbers should obviously be equal. Capnography is a measure of CO2. In this case, we're specifically measuring the end-tidal CO2, or the amount of carbon dioxide exhaled with each breath. The normal range is 35 to 45, but you'll undoubtedly encounter some patients with a different target. We always measure end-tidal CO2 continuously in intubated patients, where it's obtained via a device that fits onto the ventilator circuit, like in the top photo here. We will occasionally monitor in patients without a secure airway as well, most commonly while they are receiving procedural sedation. In that case, it's measured by a device like this one on the bottom here, that's worn in the nose like a regular nasal cannula. Capnometry, like the other measurements we've discussed, shows up on the patient monitor where it is displayed as both a waveform and an instantaneous value. Hopefully you'll get to hear more about the information you can get from the end-tidal waveform during your rotation. One thing to note is that the end-tidal CO2 will almost always be lower than the measured CO2 on the blood gas, as some carbon dioxide is inevitably lost into the atmosphere and not measured by the monitor. You can correlate the end-tidal at the time of the blood draw and follow trends, as the amount of variability between the two readings is usually fairly consistent. Finally, non-invasive blood pressure. This is just the cuff blood pressure you all know and love, but we do tend to measure it more frequently in the ICU than on the floor. The normal pressure, of course, varies by age. The most recent non-invasive pressure can be seen at the bottom left on the monitor. A list of the 6 most recent readings is also displayed, which can be particularly helpful if you need to troubleshoot an abnormal value. If you need to cycle the cuff to take a new pressure, you can do so with the start and stop button. An accurate measurement depends on using the correct cuff size for the patient. It's also worth noting that with appropriate sized cuffs, a leg pressure will generally be higher than an upper extremity pressure. Arterial line pressures are more reliable than cuff pressures, so if a patient has both, trust the art line and use that pressure to make decisions about clinical management. Thanks for listening.